or simply phencyclidine. And what is a dissociative? They're also referred to as dissociative anesthetics, and it's a class of psychedelic drugs. The drugs are characterized by a distorted sensory perception and a feeling of being disconnected or detached from the environment and from yourself. The word dissociative means detached from reality. And yeah, we already went over the list of drugs. Those are the ones that we'll cover a little bit. And I was actually looking at dextromethorphan more because of its recent increase in use, and also because they found a therapeutic use for it other than just cough suppression. Anyway, ketamine is a dissociative anesthetic. It's still used for surgery both in humans and animals. It can cause memory loss as well as pain relief, and at low doses can produce stimulant effects. Medium to high doses produce out-of-body or near-death experiences. Sounds lovely. PCP is a drug that's both hallucinogenic and dissociative. The dissociative effects of PCP leave users feeling removed from their body and the environment. This effect produces a trance-like state. It has strong anesthetic effects, which produce amnesia or memory loss. So it's kind of like a blackout when you're drunk, and analgesia or pain relief. And it's also, of course, known as angel's dust. DXM or dextromethorphan has been called lean or dank. It is a medication usually used in cough suppressant cold and cough medicines. It's sold as a syrup, tablet, spray, or lozenges. Nitrous oxide is a anesthetic gas that has some of the same properties, produces a disassociation between the mind and the body. You feel like you're floating. Your body is still there, but you're floating, and distorted perceptions. And in rare cases, it can cause visual hallucinations. So PCP is a chemical that's synthesized. It's not really found in nature. The precursor chemical was synthesized in 1929, and it wasn't until 1956 that PCP was first synthesized by a pharmaceutical chemist at Park Davis. They didn't try it on humans till the next year, and then they patented it in the early 60s as an anesthetic. It wasn't too long thereafter that it was banned for human use because people kept waking up from surgery angry, hostile, and sometimes with superhuman strength. So it would take like 5 nurses and the doctor to hold the patient down. So yeah, it didn't take too long for them to realize it wasn't a very good anesthetic for those reasons. After that, it was re-released as almost the same name, but this time an animal anesthetic. And the what? Probably. I mean, I wouldn't want to be in the same cage with a tiger after you anesthetized it with PCP. It'd probably be trying to eat its way out of the cage or something. But anyway, PCP began to show up on the streets as a recreational drug in that same year. And probably part of the reason that it showed up there is because it was so easy to make. And in 1978, under the Controlled Substances Act, it was moved to a Schedule II. And 79 saw a rise in use, or probably near a peak. And during that time, about 7% of high school seniors had reported using PCP in the last 12 months, which seems unbelievable right now, but whatever. And from the 1980s to present, it has remained a problem drug, but numbers have declined. So in the mid to late 1970s, PCP was the most notorious drug in America. It garnered unprecedented negative attention from all media sources and was labeled most dangerous drug in America and a devil drug. Speaking of moral panics, which we will cover, tales of superhuman strength, users impervious to pain, self-mutilation, extreme violence, both murders and suicides, and led what some sources referred to as the dusting of America, as surveys showed that approximately 20% of all middle and high school students had at least tried PCP once. So 1 in 5. So some of the sensational media, you've got this thing with paper clippings about angel's dust, what everybody should know about PCP. And then you have this death drug movie, which of course is at best a B-rate movie by one of Miami Vice's co-stars, where he becomes a PCP addict and goes bonkers. Like, for instance, this is one of my favorites right here, this picture. And I have a documentary on PCP, but I'm not sure which part. So I'm just going to play a little bit of the first part and see if that.
Receiving PCP or angel dust.
If you got a really good moment, you can't really talk about it, but if you're really into it, you know what you're talking about.
Man, I just want to fight. Let me get it out of you.
I'm not crazy. When I'm high, if I had a gun, I'd probably shoot myself.
Candy, how old are you now?
12,
How old were you when you first started smoking?
11.
Bencyclidine hydrochloride, PCP, was developed 20 years ago as a surgical anesthetic. In early tests, scientists found out that 1 out of 3 people woke up screaming in a state of temporary insanity.
Now the same chemical made in underground labs has become a major drug problem in most large cities in the United States. In Los Angeles, PCP-related arrests have risen 2,000% in the last 4 years. In New York, 1 in every 6 students in junior high and high school has tried PCP at least once. It is now second only in popularity to alcohol and marijuana among school-age drug users.
How did you feel when you used the antidepressant?
I don't know. I just felt blazing.
I'm Joanne Woodward.
And I'm Paul Newman. PCP is the latest and potentially the most dangerous drug to hit the youth drug scene. The National Institute on Drug Abuse estimates that over 7 million people have used PCP. Many are hooked on it.
According to one study, the average age for using angel dust the first time is 14. It is cheap and easy to buy. The cost of a joint laced with PCP is about the same as a school lunch.
But the effects are unpredictable and they are uncontrollable. Many experts say angel dust is the most destructive drug in the street. We'll find out why from the people who use it.
I have left home and have gotten lost, didn't know my way back home.
I looked at her until she went to the bottom of the swimming pool. And then, even when she was at the bottom, I said, "You really swim under the water real good."
You mentioned it was a pretty good sized caliber gun. How big a gun did you use?
357.
Which would normally kill a person with one bullet on close range with.
Yeah. But it was 2.
So that's a great example of, in my opinion, the media coverage that can create a moral panic.
Do you think that's the case for, or that's happening right now with fentanyl?
Well, I would say not really, because I don't see a whole lot of popular press demonizing fentanyl. They're just talking about the deaths from fentanyl. But I imagine you could make a case for it. It's just not as blatant as with PCP, where the people were doing things that were considered crazy during use. And we'll get into it, what kind of things were reported anyway. And like marijuana, the things that were being reported were uncharacteristic of people who actually used. Like there was their report of a teenage boy getting high on marijuana and then killing his whole family with an axe.
Yep.
And that was blamed on marijuana. And so normally, I think when people get high on marijuana, they sit down on the couch and they have a hard time getting up. So I would consider that report to be unreliable at best and an extreme exaggeration. Now, the demonizing of PCP is harder to say that it's not related to the drug, because definitely in some people, it brings out the absolute worst, it seems. So it may be a fair characterization of how some people respond when high on PCP. It certainly isn't a fair characterization of the average person high on PCP, thankfully, because I have some people in my neighborhood that use it every day. I see the cigarette butts. But anyway, so this is the chemical structure of PCP, and this is ketamine. So you can see that they're similar structures, and methoxetamine. And although I don't have the structure up here, the actual structure of dextromethorphan, which we'll get to, and codeine are also similar. But the basic structure for this group of anesthetics is an aromatic ring, which is a benzene ring, and then a cyclohexyl ring or group, and then cyclopentylamine, which just means 5 carbons and a nitrogen in a ring. So then there's different types of amines that can be added here, different things that can be added to this cyclohexene ring. And I believe this is pretty much conserved, but this is the group of aryl cyclohexylamine dissociative anesthetics. Now, if that ain't a mouthful, but anyway, so there's ketamine, here's PCP, and methoxetamine here, and then a number of other derivatives of either PCP or ketamine, and then some drugs that we're not really going to cover, but they're also drugs that have been tried as anesthetics. So another interesting characteristic of PCP was that during the 70s, late 60s, it was one of the easiest drugs to make. And so it became the ultimate drug of deception. Many drugs of abuse were either laced with PCP or substituted entirely for PCP. PCP was easy and cheap to produce in a clandestine chem lab, and between 71 and 75, only 8.7% of PCP and TCP, which is similar to PCP, samples detected by a street drug program were actually sold as PCP. So that's over 90% of PCP being sold as, among other things, LSD, mescaline, psilocybin, cocaine, or THC. So instead of the expensive cocaine, they would just cut it with a bunch of PCP and call it cocaine and sell it. For reasons that are not exactly clear, PCP use has remained almost entirely confined to the US and Canada, with only scattered anecdotal reports describing use in the EU or elsewhere. And I think that's because over in the EU, they never got the formula. Just kidding, kidding. Maybe they were smarter. They were like, this stuff is garbage. Who would want to get on this stuff? Dissociatives, I mean, we talk about people trying to escape using drugs. Dissociatives are something that actually give you a physical sensation of having escaped from your own body. So these drugs basically help you to take that literally. Dissociatives, although they don't get a lot of press, is a fairly large group of drugs. The one that probably gets the most press is PCP, but it's certainly not the most widely used dissociative. That's a toss-up between nitrous oxide and dextromethorphan, or cough syrup. So these are the ones that don't get a whole lot of press, but are widely used. Ketamine is also relatively used. Oxetamine is not widely used in the United States. GHB used to be widely used, and both GHB, or gamma hydroxybutyrate, and rohypnol are known as date rape drugs. And then a couple of the gas anesthetics are also dissociatives, chloroform and diethyl ether. So once again, we're stuck, at least to a certain extent, because this survey looks at primarily categories like hallucinogens, which does contain some dissociatives, along with all of these other drugs, and inhalants. So they break it up. I guess inhalants is a method of use, and hallucinogens is a concept they consider easy for people to understand. But we're trying to look specifically at dissociatives, and so dissociatives like nitrous oxide, chloroform, diethyl ether are included in the inhalants. So that's to say that it requires some digging to actually find the epidemiologic information in this survey. But once again, past year initiates, some of them are here, and some are in this category. And PCP is the one that we're paying attention to here for past year initiates. And obviously it was primarily used during the 70s and some during the early 80s,
And use has basically tapered off since then. Not sure if this recent increase in use is a transient, as in will go away, or if it's actually a trend that will continue. Only time will tell, of course. So then this is looking at the difference between initiates in hallucinogens and inhalants, those two categories, along with PCP. So inhalants have actually gotten popular, not too surprisingly, with raves around the turn of the century, and hallucinogens with ecstasy around that same time. And inhalant use has tapered off pretty much since then, and sharply down during the pandemic. When it comes to past month use, hallucinogens and inhalants, both relatively on the small end of things, about 2 million people for hallucinogens and just under 1 million for inhalants. And for past month use, same 2.2 million and just under 1 million. So the one that certainly got the most press is PCP. And once again, here's the data problem. This is a survey that's geared to look at things that are more than 1%, and the number of people that are using PCP is very small, so it looks like 0. But if you actually look at the numbers and do an estimate, it's around 0.05% of the population, maybe, or less, that are using PCP, what appears to be on a regular basis. So this is looking at the difference between initiates, last year users, and past month users for PCP. And there's not a lot of difference. So most of the people that used PCP in the last year actually were trying it. And once again, the relatively small number of people using it in the past month. And the most recent trend, of course, is increasing for all of these categories. There's more people trying it, more people having used it in the last year, and more people that have used it in the last month, but still a very small number of people, 0.05% of the population or less. So then looking at lifetime use for hallucinogens, got PCP hovering around 2% over this entire period from about 1985 to 2021. And having ever tried PCP, lifetime users, about 6.5 million people in 2021 had ever tried PCP. And if this isn't a classic example of the difference between having tried it and currently using it, there isn't one, because this is probably the easiest to see that these people try it and they don't continue, because you're, on the order of 0.1% of the population that are initiates last year or last month users, way down here. So then turning to past year users, and there are these categories, not too useful when you're looking at dissociatives, because we're talking about a subset of hallucinogens and a subset of inhalants. So for PCP, past year use has been small, on the order of 0.2%, down to about 0.1% right now. And then this is looking at the age distribution of who's using PCP in the last year. And clearly it's been young people, almost as large a prevalence or percent of 12 to 17-year-olds as 18 to 25-year-olds. And you can see that it's been declining as well. For ketamine, slightly different story. More people are trying it, and more people are becoming past year users as well for ketamine. Although when you look at the specific age categories, mostly 18 to 25-year-olds that are trying it. And the average user, though, is greater than 26. And the trends for ketamine use are really noisy. Data's all over the place, but basically, overall, there's been a slow increase in the number of people that are past users of ketamine. Still, most of them, or the most prevalent groups with the highest prevalence, are the younger people, 12 to 17 and 18 to 25-year-olds. and this is another paper that was looking at trends in ketamine use, looking at slightly less noisy data and showing that right before the pandemic, from about the middle of 2018 to the end of 2019, that there was a dramatic increase in the number of people in this age category that were using ketamine. So for comparison, the number of people that have ever tried ketamine is about 4.5 million people as of 2021. And I didn't have the past year and past months users, but it's small by comparison. And then looking at lifetime users of ketamine, you can break it down by age, and the majority of them are in the 26 and older category. And you can break it down by gender, and about twice as many, well, a little over twice as many guys are using ketamine as girls. So one that doesn't get much press, cough syrup. So ketamine, we have 4.5 million users. Cough syrup, non-prescription use of dextromethorphan, 10 million people have tried it, at least. Traditionally, that's been primarily the 18 to 25-year-old group, but lately it's been 26 and older. Yes, Bailey? Did you have a question, Bailey?
Oh yeah. Is ketamine is the same thing as horse tranquilizer, isn't it?
Yeah, it is a veterinary tranquilizer.
Okay, because I was watching on the news last night that they have a new drug that is fentanyl with horse tranquilizer, and it's kind of new.
Yes, yeah, that's a different tranquilizer, but yes, that's true. There is an increasing mixture of this, another veterinary tranquilizer with fentanyl that's causing a lot of people vascular problems, because that particular tranquilizer is not widely used even in veterinary medicine, and it's being added because it extends the high for fentanyl. But it also decreases circulation. Seems to cause not vasoconstriction, but arterial constriction. And so people end up with, well, they routinely inject the fentanyl under their skin. And because it's causing a diminished circulation to that area, it causes that area of skin to die if they're frequently injecting that mixture. So then these people end up with very large open sores, possibly gangrene. There's a lot of people that are, if they're a hardcore user of that mixture, ending up with amputations even. But that's not ketamine.
Okay.
And then the other one that doesn't get a lot of press is nitrous oxide, or laughing gas. And for comparison, that's 12.3 million people that have ever tried it as of 2021. For whatever reason, I couldn't find the data in this range, but as far as I could tell, the highest prevalence of use was in the 18 to 25-year-old age group, and it was just after the turn of the century in about 2003. And that was about 10% of the population that were using, or 10% of that age group rather, that were using nitrous oxide at that time. And use by that age group has significantly diminished since then. And it's been slowly increasing amongst the 26 and older group, which currently represent the average user. So there's a lot more people using cough syrup and nitrous oxide, which are both dissociatives, than there are using the traditional, quotes, dissociatives. And I also wanted to bring your attention to the fact that there was a recent article in the New York Times about, well, its title was Nitrous Nation, Hippie Crack, Whippets, Laughing Gas, and they called it a enduring party drug, casual party drug even. And I just wanted you to take a moment to ponder what kind of message that sends to young people when you have an article in the New York Times calling it a casual party drug. This casual party drug can cause people to asphyxiate and also can cause peripheral neuropathy in people that use it heavily. So just like any drug, when you use too much of it, it can be very harmful. All right, so let's look at what Monitoring the Future has for use of dissociatives. Fortunately for past year users amongst 12th graders, the numbers are consistently down at less than 1%. When it comes to ketamine, it's a small number of users, probably about 2% of 12th graders, and they aren't monitoring 8th and 10th graders anymore as of 2011. For PCP, if you look at the actual trend, So this is looking at something that's comparable because it's all the way from 0 to 100% of 12th graders. If you zoom in on it, it was at a maximum back in 1979 at about 7%. If you can believe it, about 7% of 12th graders were past year users of PCP. Currently, it's about 1%. And then this is also zoomed in. So the maximum here is 2.6% of any one of these grades. And it's at about 1.2% maybe of 12th graders that are past year users of ketamine. But by comparison, use of over-the-counter cough medicine or cold medicine containing dextromethorphan has been recently increasing in popularity. Of course, they added it to their survey back here in 2006 when it was at a peak. So who knows what it was doing before that. But the unfortunate trend is that amongst 8th graders, there's been a sharp increase in use, even while the use amongst high school seniors is going down. So apparently the young people the really young kids in 8th grade are using it with a higher prevalence than 10th or 12th graders. So I would expect this dramatic increase here to eventually be reflected as it is here in the 10th graders, and then most likely the 12th graders if it's something that continues as these kids move from 8th to 10th to 12th grade. So they do have information on Rohypnol amongst 8th, 10th, and 12th graders. And for reference, that's 1.6% of any one of those grades. And the trend amongst all grades has been down, but certainly it's more popular amongst high school seniors. And GHB, they have data for that as well. And the trend for that has been down as well, which is good. And we're talking about less than 2% of high school seniors, now currently at about 0.5%. Some pictures that I didn't have a chance to throw into the presentation yet, because I was just making them. This is comparing lifetime use amongst hallucinogen and inhalant, along with the specific drugs, PCP, nitrous oxide, dextromethorphan, ketamine, and GHB, so that you can get an idea as to their relative prevalence lifetime in 12 and older. So once you remove these categories and look specifically at these drugs, you can see that nitrous oxide and dextromethorphan are both considerably more popular than PCP, ketamine, or GHB. So when we talk about dissociatives and who's using what, the two drugs to keep an eye on are nitrous oxide and dextromethorphan, because that's what people are using by the millions. And PCP is kind of an intermediate in terms of the number of people that have ever tried it, and ketamine and GHB currently are relatively small number of people that have ever tried it.
So look at the pharmacokinetics. What does the body do to the drug? Well, there's a number of different methods of administering PCP. Of course, the only method that was actually tried anesthetic-wise was IV. So all of the other methods were experimented with through the illicit use of PCP. One of the most common ways, at least in my neighborhood, is to use something like embalming fluid. Well, you see, I'm responsible for walking the dogs. So every day I go out and I walk the dogs. And I started to notice on this one particular sidewalk, not too far from my front door, were these cigarette butts that looked like they'd been dipped in embalming fluid. And I was like, what the F? Formaldehyde? I don't know. I think you can get formaldehyde at a hardware store. And then it's a good solvent for PCP. So then you just dip your cigarette in it. And that's an effective way, supposedly, of administering PCP. So that's why they keep showing joints, cigarettes, or even cigarellos, you know, Swisher Sweets or something. Yeah, the little, yeah, all that flavored crap. But anyway, so the actual studies on absorption, we're looking at PC administered IV, PCP, because that was the only way it was actually
administered under any kind of controlled environment. Illicit use, of course, is used multiple routes, including IV, eating it, and snorting it. And supposedly there's good bioavailability, and it does cross into the CNS. Typical dosages in tablet form are 1 to 6 milligrams, 1 to 10 milligrams when put on a cigarette or a joint, and IV, it's like 0.1 to 0.25 milligrams per kilogram, and roughly about 10 milligrams. So somewhere in the range of 1 to 10 milligrams is the typical dose. I'm sure that has something to do with how repeated your use is and how long it's been. And the distribution or the onset for inhaling it from like a cigarette or a joint smoke is between 30 seconds and 5 minutes. And of course, it's quite a bit slower if you eat it or swallow it, 15 minutes to 60 minutes. And it has a large volume of distribution. So it gets into almost all of your tissues at 6.2 liters per kilogram, and it easily penetrates into the brain. It's also rapidly absorbed into adipose tissue. So it can be detected in your fat, kind of like THC, 4 weeks after you've stopped using. So, and that's, of course, after it's undetectable in your blood. And also, due to its depot, that's what this type of activity is referred to, hanging out in the fat or some other part of your body effect in the brain and fat, the pharmacodynamic effect of PCP are experienced long after the plasma or serum levels of the drug have been cleared. And that's because, fortunately or unfortunately, your brain is mostly fat. Like it or not, it's a big jello butterball. Weight so much, right? And that's why some people's cranial syncytia have not closed, and therefore, as their brain gains weight, their brain just expands. So then you can call them fathead. Some freaking movie somewhere where somebody put a needle in their head and they were like, turn on the gas and see what happens. All of a sudden, like a balloon. Based on lipophilicity. PCP goes into the fat tissue and can hang out there for a long period of time, but it also exists in this protonatable form. So that's highly charged, has a positive charge. And with that charge, it's easy for it to circulate in your blood. It also undergoes that interesting enterohepatic recirculation where the hepatic or the liver metabolizes it, excretes it in the bile into the gut. Bacteria have an enzyme that reverse metabolizes it, and then it's reabsorbed from your intestine back into your bloodstream as PCP. So that can establish a little circle for you from the liver to the little bacteria and back again. And of course, this would be your intestine. Yay! All right. So, coupled with the accumulation in lipid stores and the slow release from those stores, chronic PCP users can experience highs that last for weeks and months. And that can lead to a case of what's called PCP intoxication, where they've used so much that they can't come down for weeks to months. Yeah, that is why I think you get these people that do these bizarre and twisted things on this, because their brain is fried and normally they would want to recover, but they can't because they've used too much. And so they continue to be in that state of delusions and hallucinations for weeks to months. And I don't think anybody's brain can handle that. Anyway, this prolonged exposure, even in acute use, can lead to PCP flashbacks, where unlike with LSD, your brain is imagining what it was like to be on LSD. And that's an LSD flashback. This is where the release of PCP from your fat tissues is actually causing you to go from being unintoxicated to intoxicated. So this is physiologic. This isn't imagined. Yeah, and there are various things that can cause that. One is extreme stress. All right, the primary site of PCP metabolism is not surprisingly the liver, and it is acted on by many different enzymes. Only 10% of PCP is excreted unchanged in the urine. And studies in the human liver, microsomes and hepatocytes have identified up to 7 phases of oxidative metabolism and a number of phase 2 conjugates for PCP. So this is PCP, and the major enzymes are these ones in red that work on it to form. So M4 is this compound. Now, I don't want you to memorize these. Don't worry, don't trip, not worrying. But a number of these are actually theoretical, as in an organic chemist said this reaction is possible, but they haven't actually been found in humans. So M5, 6, and 7, they haven't found. So this is an interesting metabolism chain in that it turns PCP into a charged, that's a negative charge there, which can then go through this oxygen rebound to form a hydroxyl group. So then this is a polar molecule now and not nearly as fat soluble and will most likely easily be excreted in the urine. However, this is not stable and it can go to a positive charge where that electron has been removed. And that also then is unstable and can actually form a conjugate with a protein. So you can get PCP then bound to a protein. And unfortunately, it's not too hard for this bond to be broken. And then you're once again releasing PCP back into circulation. Like, what good was that? I don't know. But that's part of your body's way of trying to get rid of it that didn't work. All right, so 90% of PCP is metabolized in the liver during first pass by oxidative hydroxylation. Then subsequently, an adjuvant is added and it's excreted in the urine. 9% of ingested PCP is excreted unchanged. The duration of the high usually lasts 4 to 6 hours. However, there are cases that are reported up to 48 hours or even weeks. So even with all the different ways that PCP can be metabolized, there's a lot of variability between people. So you never really know when you first take PCP how long you're going to be high. Might be 4 to 6 hours, that's typical, but it might also be 4 to 6 days. And that's because this half-life for elimination is between 7 and 57 hours with an average of about 17 hours. And it's this bimodal distribution that kills you. So you get, this one blip of people that can eliminate the drug in between 7 hours and say, I don't know, 20 hours. And then you get another blip of people out here which can eliminate it in 57 hours to maybe 48 hours. And the average then is somewhere in here at 17 hours. And that's a bimodal distribution. So if you happen to be in this group of people, you're going to be one of those people that gets high and stays high for on the order of 48 hours, which would be 2 days to weeks. And if you're in this group, you'll be the ones that, typically are high for 4 to 6 hours. And you don't know which group you're in. So what about ketamine? Well, being an anesthetic used both for animal and human surgery, it's available mostly as an injectable, but certainly there has been powder produced, and there's also now a ketamine inhaler, or nasal spray rather, I should say, that's used for people with depression. So ketamine has actually been shown in this relatively small dose to help people that are suicidal reverse that and become much less suicidal and less depressed, which is unusual given it has almost no effect on serotonin. So this is part of the reason why the serotonin hypothesis was shown to be bunk. But anything behavioral, if somebody says, this is a behavior, like depression or anxiety, or for that matter, addiction, and they say it's related to one neurotransmitter, you can automatically know they don't know what they're talking about, because there is no such thing. So it has wide-ranging bioavailability. Oral, not so good. Sublingual, also not so good. If you snort it, you might get up to 50% bioavailable. Intramuscular is roughly 93% bioavailable. IV, of course, is 100%. And then even rectal is not so good for this one. When it comes to distribution, the onset is between 1 and 5 minutes for IM injection, and 15 to 30 minutes for subcutaneous or oral administration, and something intermediate for snorting it. And the maximal concentration is usually reached in 1 to 3 minutes for IV, 5 to 15 for IM injection. For snorting it, 10 to 20 minutes, oral 30 minutes, blah, blah, freaking, no, just kidding. But you can see that it's a range. It goes from everything from a minute to 45 minutes, depending on how you administer it. And ketamine, like PCP, is highly lipophilic, so it readily goes into fat tissue and thus crosses most barriers like the blood-brain barrier and the maternal placental barrier. And it reaches near full distribution in about 7 to 11 minutes. And interestingly, I guess, given that it's highly lipophilic, you might also consider that it would be highly protein bound, but it's not. It's what, about, 12 to 47%. That's a pretty broad range, but on average about 25%. And when administered orally, ketamine undergoes a first pass metabolism in the liver into norketamine.
And then that intermediate is then further metabolized into this dihydronorketamine. But as metabolism or a metabolite of ketamine, norketamine is 1/3 to 1/5 as potent an anesthetic. So it's still an active metabolite. So this contributes to the effect of ketamine overall. And it lasts in the plasma 3 times as long. So it builds up to a higher concentration after oral administration than ketamine does. And when it comes to elimination, in the clinical setting anyway, after intramuscular injection, the duration of action is about ½ hour to 2 hours, oral administration 4 to 6 hours. It's about 90% of it is eliminated in the urine and a little bit in the feces. And it's excreted mostly in the form of a metabolite. Only 2 to 4% is excreted unchanged.
The final group of recreational drugs that we will cover are the hallucinogens, along with cannabis, which is not classified as a hallucinogen, but does not fit well into any other category. In contrast to stimulants and depressants, hallucinogens do not follow your traditional sympathetic versus parasympathetic rules. In addition, their physiologic effects are not as clear-cut and tend to have to be memorized directly. Therefore, some extra attention needs to be applied here. The last class of drugs that we will cover are known as dissociative psychedelics. In contrast with serotonergic psychedelics, which affect the senses primarily, these drugs are characterized by a state known as dissociation, where the person does not feel like they are connected with their body. Dissociative psychedelics work by antagonizing the glutamate receptor, specifically the NMDA subtype. The first dissociative psychedelic we will cover is phencyclidine, or PCP. PCP is almost guaranteed to show up on a test somewhere, so pay close attention. PCP has significant hallucinatory effects, but is better known for clinically inducing belligerence, impulsiveness, agitation, psychosis, and delirium. On boards, there's a classic vignette about a patient who is so agitated and belligerent that it takes 5 cops or nurses to restrain him. If you see this, always think PCP. There were a few high-profile cases about people doing terrible things while on PCP, most recently in 2002 when the rapper Big Lurch murdered and allegedly ate parts of his girlfriend while under the influence of PCP. Other news reports talk about people who pulled their own teeth out while on PCP. Use of this drug has declined since it was first introduced, likely as a result of reports such as these, but still be on the lookout for it on boards and in the emergency room. Test questions on PCP intoxication will sometimes state that the patient is exhibiting signs of horizontal, vertical, and/or rotary nystagmus on exam. This is also classic for PCP intoxication. Know it well.
Nystagmus is a rhythmic, involuntary movement of the eyes. This is one of the first signs that parents may observe in a child with a congenital visual impairment. It is most often a horizontal pendular nystagmus where the eyes rock back and forth equally like a pendulum, but other forms of movement are common. Stress, emotions, and direction of gaze can cause changes in the nystagmus and may cause vision to decrease. Here we see the nystagmus can change direction and speed as the patient looks in different directions.
Withdrawal from PCP is a poorly characterized state, but generally it can be said that these patients aren't feeling their best. The very last drug we will cover is ketamine, which is used both in clinical settings for emergency anesthesia, such as setting a broken bone in a kid who fell off playground equipment, as well as in recreational settings since the 1970s. Like ecstasy, ketamine is popular as a club drug. In addition to its use as an anesthetic, ketamine has significant psychological effects. These effects are complex, with people on ketamine reporting feelings of depersonalization, detachment from their bodies, euphoria, loss of time perception, and even spiritual revelations. Like PCP, withdrawal from ketamine is poorly understood. When used on a short-term basis in a medical setting, there does not appear to be any significant withdrawal effects. It is unclear if there are withdrawal effects when used on a longer-term basis. Anyway, this isn't high yield, so let's move on. As a final review for recognizing toxidromes on boards, I like to remember the phrase, "it's all in the eyes." On questions asking you to recognize different drug states, they will often give you some information about the eyes. For example, if the pupils are dilated, you know you're either dealing with stimulant intoxication or depressant withdrawal. Conversely, constricted or pinpoint pupils mean you're dealing with opiate overdose or stimulant withdrawal. Nystagmus in the context of substance abuse is likely PCP. And finally, conjunctival injection is probably marijuana. Know these well, they will help you on tests.